The CDC says more than 80% of new COVID-19 infections here in the U.S. are caused by the newest Omicron subvariants. Listen.
We do not know yet about the clinical severity of BA4 and BA5 in comparison to our other Omicron subvariants, but we do know it to be more transmissible and more immune evading. People with prior infection, even with BA1 or BA2, are likely still at risk for BA4 or BA5.
Here to talk more about that is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor.
Hey, Dr. T, it's great to see you. Well, you just heard Dr. Walensky say more transmissible, more immune evading. Those are sobering words today from the CDC director. So in your opinion, how concerned should we be about BA4 and BA5?
Well, Eddie, I do think we have to be concerned because remember, there's still 350 deaths a day in the United States from COVID. That's just too many. But the good news is that we really have uncoupled the number of cases with hospitalizations and deaths, meaning there's so many cases, so many more than are being reported because of the at-home testing. And when you look at hospitalizations and deaths, they are still down, even at a time when BA5 is surging.
Doctor, as you know, here in Massachusetts, a lot of people are vaccinated. Many are boosted. Some have natural immunity after having a prior infection. So do any of those things separately or together protect a person from infection by BA4 or BA5?
Maria, I'm glad you asked this question because it's a little confusing because right now we're seeing many of us that are vaccinated, but still we're getting infected, our friends are being infected, what's going on? The good news is when you look around, most patients are not being hospitalized. Most of us are not dying. Why? Because the vaccines and prior infections and that hybrid immunity, which means both, are really protecting against severe illness. The name of the game right now is reducing severe illness. We can't really reduce infections as well or transmission as well, but we're keeping people out of the hospital. We have the tools to do that. It not only includes vaccines and boosters, but it also includes the treatments like Paxlovid. So test and treat for high-risk people with symptoms to get the diagnosis and get them on treatment quickly is really something that will reduce hospitalization and deaths as well.
So, Dr. T, that's a perfect lead up to the next point. We know that you care about everything, but you focus about hospitalizations and deaths. So, are you seeing any signs yet that either of these subvariants cause serious enough symptoms to elevate the concern level in those areas?
Right. You know, we're still learning a lot about BA4 and BA5. Let me be clear. BA5 looks like it's eking out the BA4 and even the BA2.12.1. That's really being forced off stage as well, as one of the experts said earlier. So I think the good news is that while there are still a lot of cases, Ed, that our testing, our treatments, our vaccines and boosters are still working. So I want to make it clear, if you have not gotten vaccinated in 2022, whether that's a first booster or a second booster, or even if you're unvaccinated, it is very important that you get that now. And by the way, if you're vaccinated or boosted right now, that does not exclude you from getting the fall vaccine that will likely contain one of the variant-specific vaccines. In fact, it may be a 2-valent vaccine. So getting vaccinated and boosted now makes sense.
Doctor, with the original COVID strain, everybody was concerned about fevers and trouble breathing. People who were seriously ill, they were put on ventilators. Is that still happening, or do these new subvariants come with a totally whole different host of concerns?
Maria, it's happening, but it's happening so infrequently, like night and day compared to where we used to be. And that it has not happened by chance. It's not because BA5 is this wimpy variant. It's not. The fact is we have a greater immune wall because of our vaccines that are working, because the boosters are working, because of the fact that prior infection also works as well. And all of that, in addition to the antivirals, we're keeping people out of the hospitals. And if we're keeping people out of the hospitals, we're keeping them out of the ICUs and off ventilators as well.
I hear some optimism in your voice there, Dr. T. It's great to hear it. Great way to start
the week. There's a lot of optimism. We have the tools.
Great to see you, Dr. T.
Great to see you, Doctor.
Take care.
Be well.
Take care, guys.
And